Well, first of all, I will say thank you for the organizers for inviting me to come here to make a presentation today. And to say a little bit about who I am, I'm an associated professor at the Danish Center for Alcohol and Drug Research at Aarhus University, but I live and work in Copenhagen. And the outline of my presentation is that I will shortly present some data about the drug use and drug problems in Denmark. Then I will present the modern Danish drug policy because I think that's important to understand this as in order to understand harm reduction in Denmark, because it's very much in a Nordic welfare state perspective that you should understand harm reduction in Denmark. Then I will go through the evolution of different elements of harm reduction policy in Denmark, and finally I will say a few words about the current status of drug policy in Denmark. Denmark is a small country. We have 5.5 million inhabitants, and we are, however, one of the countries in Europe with one of the highest prevalences of drug use. Here we have some EMCDDA data about the prevalence of cannabis use, where you can see that Denmark comes in as second, only to France, on prevalence of cannabis use, lifetime prevalence. And if you look at people who have used drugs, cannabis for the past year, France is still the leading country in Europe. Denmark comes in as fourth, along with the Netherlands, surpassed by the Czech Republic and Spain. If we look at the development of drug use in Denmark, then you could say that in Denmark there was an increase of drug use during the 1990s, and then it stabilized at a rather high level during the 2000s. And that goes both for cannabis and other illicit drugs. But in the most recent survey that has been conducted from 2013, we see an increase in cannabis use. It should be said when we look at these figures that in 2004, Denmark introduced a zero-tolerance policy on possession of illicit drugs. But apparently this has not affected the demand for these illicit drugs in Denmark, because as you see, it's quite stable, the prevalence, and for cannabis it has even increased in the last survey. If we then look at problematic drug users in Denmark, it is estimated that we have around 33,000 problematic drug users in Denmark, and about 13,000 injecting drug users. And then we have it estimated that around 11,000 of the problematic drug users have their main problem with cannabis. And as you say, these data are from the Danish National Board of Health and the data they report for the EMCDDA. The latest, we have had some problems about registering drug users in treatment in Denmark, so the latest data is from 2011. And during 2011, there were 16,000 drug users in treatment at one time or the other. And about half of them, around 7,000, were in substitution treatment with different substitution drugs, methadone, buprenorphine, mainly these two drugs at that time. When we go to drug-related deaths, then Denmark saw a quite sharp increase of drug-related death in the early 1990s, whereafter it stabilized at a quite high level. And then we have seen a slight decline for the past years, but to my knowledge, the numbers for 2014 should actually be at the high level again. This increase in drug-related death in the early 1990s led to drug policy and particularly drug treatment to become an important important political issue in Denmark. And a few years later, the government made a white paper on drug policy, and it actually meant that a lot of resources were put into drug treatment during the 1990s and also the 2000s in Denmark. It also started discussions about introducing heroin-assisted treatment and drug consumption facilities, a debate that lasted for many years, 15 years at least. If we look at hepatitis, at HIV and hepatitis, then it is estimated that around 5% of intravenous drug users in Denmark have HIV. And there are 14 to 24 new HIV cases each year, and it has been like this for the past 10 years. These are about 4 to 9% of all new cases of HIV in Denmark. On the other hand, if you look at hepatitis C, it's estimated that 75% of Danish intravenous drug users are infected with this, and it's around 35% that is estimated to be infected with hepatitis B. This has caused quite a lot of alarm among medical doctors working in drug treatment and working with drug issues in Denmark. And in 2007, the National Board of Health made a prevention program for hepatitis, where the municipalities, who are the authorities that are responsible for drug treatment and health services in Denmark, were obliged to provide screening for hepatitis and also HIV for drug users and provide them with vaccinations for hepatitis A and B. Now I'll say something about the modern Danish drug policy as a context for understanding the development of harm reduction in Denmark. Possession of illicit drugs was criminalized in 1955 with the introduction of a law called the Law on Euphoriant Substances. Before this, it was not illegal to possess illicit drugs for personal use in Denmark. But the main change and the basis for the current Danish drug policy happened during the 60s and 70s, when a new kind of drug user associated with the youth rebellion developed. And these drug users, and particularly the drug users who had problems with controlling their drug consumption, became a big problem for the psychiatric system, for the youth and healthcare system, and also for the prison system, both in epistemological terms concerning, well, how should you understand this new phenomenon, and also with regard to which methods you should use to treat them. But also very significantly, these new drug users were a cultural challenge to these institutions because they questioned the authorities of doctors, treatment professionals, etc. And therefore, new treatment experiments were conducted among activists and also by some of the social institutions in Denmark. And actually a new specialized drug treatment system was developed in Denmark. And this system was based on a sociological understanding of drug use as a learned behavior that affected primarily people who were socially disadvantaged. And this meant that drug treatment in Denmark should primarily be about resocializing drug users. It should be about providing social services, and it should be about providing social rehabilitation for drug users. And the main professionals in the Danish drug treatment systems were social workers. And you could say that this way of conceiving the drug problem in Denmark is quite similar to the way it was conceived in the Netherlands, because the drug problem was seen as a normal social problem. It was fundamental social and structural changes in Danish society that created the drug problems and also created the increasing demand for intoxicated illicit drugs. And therefore, the way to handle this problem would be to on the one hand, to start social reforms, and on the other hand, to conduct social engineering, you could say. There was quite a lot of optimism about the social treatment system. That was one part of the drug problem at this period. The other part of the drug problem was that new drugs entered Denmark. Until the 60s, the drugs that were used were mainly medicines derived from the health care system. But now cannabis and other morphine and opium came to Denmark from imported by mainly drug users. And the Danish authorities wanted to stop this illegal or prevent an illegal drug market for developing. And a penal code, a new section was added to the penal code with hard sanctions on professional drug trafficking and drug dealing in Denmark. But as a condition for this, a majority of the Danish parliament said that drug users should be depenalized, meaning that in most cases, drug users in possession of illicit drugs would only receive a caution by the police and then be let off. And in this way, a drug policy was developed where, on the one hand, the supply side of the drug problem was to be handled by criminal justice policy, while the demand side of the drug problem was to be handled by the welfare system and welfare policy and welfare reform. And this actually became the ideological basis for Danish drug policy until 2004, when the zero tolerance policy was introduced. In Denmark, we usually say that harm reduction was introduced in 1984. And the reason for this is that during the 70s and 80s, there was a growing population of, you could say, old problematic drug users who either could not or would not receive treatment from this specialized treatment system that had developed during the 60s and early 70s. And this meant that an increasing number of these drug users, they went to general practitioners to get them to prescribe methadone. And in this way, you could say a parallel medical, unofficial treatment system developed alongside the social treatment system in Denmark, with no connection or interaction between these systems whatsoever. This situation meant that the National Advisory Council on Drug Policy in 1984 recommended that there should be a change of treatment policy in Denmark, away from a primarily abstinence-oriented treatment system to a treatment policy that worked with graduated goals. This new policy should have as its objective to reduce burdens and harms for drug users and increase their resources. And this meant that you should be able to provide help for active drug users, something that the treatment system had not been able to or wanted to do previously. And it also meant, or it was recommended, that methadone maintenance treatment would be introduced as an instrument in Danish drug policy. This was mainly articulated as a problem of social exclusion. It was in order to provide drug users with adequate health care and social services that this harm reduction, this thinking about graduated goals were introduced in Danish drug policy. It was not mainly articulated as a public health issue. And I think that's quite significant because it actually continued the basic way of explaining the Danish drug problem as a social problem. Now I'll introduce some of the elements of harm reduction in Danish drug policy, and I will start with methadone maintenance treatment. During the 60s, already during the early 70s, already during the early 1970s, it was proposed to have methadone maintenance treatment in Denmark. But it was rejected as only treating the symptoms of a fundamental social problem. And this, of course, led, as I said, to drug users going to general practitioners for methadone. Then in 1984, as I said, it became part of the official drug policy, a treatment policy, to be able to have methadone treatment in Denmark. But the treatment system was quite hostile towards it, and actually had very strict rules about it. So it was hard to be in methadone treatment, and many drug users therefore continued to go to general practitioners. And this situation was actually first resolved in 1998, when the public authorities got a monopoly on medical drug treatment. This in turn has meant that there's been a lot of focus on quality standards in medical drug treatments. There have been implemented monitoring and auditing systems and treatment guidelines, and a treatment guarantee that includes choice of treating doctor for people in methadone treatment has been introduced in 2015. There's very little knowledge about the needle exchange programs in Denmark. But in 2013, an NGO called The Street Lawyer conducted a survey that said that it was only 2/3 of the Danish municipalities that provide needle exchange program. In the rest of the municipalities, drug users have to go to chemists to buy equipment on a regular commercial basis. In 2009, Denmark got heroin-assisted treatment, and today there are 4 Danish cities who have heroin clinics. According to the last evaluation by the National Board of Health in 2013, there had been 252 clients through the system, and 70 clients had left the system. And the evaluation showed quite good positive results. There had been a significant reduction of risk behavior and use of illicit drugs. There had been a significant reduction of infections. There's been a reduction of criminal activities, and the general social situation of drug users had been improved. In 2012, we got legislation that allowed for drug consumption facilities in Denmark, and today there are drug consumption facilities in 3 Danish cities. This was evaluated by the Ministry of Health in 2015, and it showed that there had been more than 4,000 unique users through these clinics or these facilities, and more than 350,000 instances of drug use or drug consumption in the facilities. 300 overdoses had been prevented, and no fatal overdoses had occurred. There's been a significant reduction of public drug use among drug users in the neighborhoods where these facilities are located, and there's been a reduction of drug-related litter in Copenhagen with 70 to 80%. And so, finally, the current status of Danish drug policy. Well, as I said, in 2014, a zero-tolerance policy was introduced. And there was one exception to this policy, which said that if you are a poor, drug-dependent person, then you can still be let off with a caution. However, I have conducted research that shows that even if this is legally possible, drug users get sanctioned just like everybody else. We know that, this is also part of my research, we know that it's a particular segment of the Danish population that gets primarily sanctioned for possession of illicit drugs. It is mainly young, unemployed men who are on social benefits and usually also have other social problems. And this is actually the same group from which the majority of the people who develop drug problems come from. So if you look at drug policies as part of the distribution of risks and resources in a society, well, then you can say that modern Danish drug policy, and particularly since 2004, is not very good at this because with the zero tolerance policy, actually new burdens and risks are being put on a very marginalized part of the Danish population. On the other hand, we have also seen an increase of harm reduction measures, some of them are quite controversial, and we have seen an improvement of social rights of drug users in Denmark. And perhaps you could say that today, in Danish drug policy, you can either be sick and receive these rights and access these harm reduction facilities, or you can be a criminal. And that the understanding of the drug problem in the 1960s as a normal social problem that should be handled through social reform and the social welfare system has diminished. Thank you.